Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Jerry Rogers.
Welcome back to this week's edition of the Business of America. Again, you know the drill, you know the character, the ethos of our program, and that is who are the doers in the economy, the doers, the entrepreneurs, the advocates, the scientists, the professors, those who make our economy run, our politics run, make America run, right? The Teddy Roosevelt, the man in the arena, who makes things happen. And the business of hospitals, the business of nonprofit hospitals. Well, this is something that is not part of the public discussion when it comes to healthcare. I want to make it part of that discussion because we always talk about big bad pharma, but we very seldom talk about hospitals, and we know very little about how nonprofit hospitals, how they act in this public space, this private space as well. So joining us is an old friend of the program. He is a doer. He's a professor. He's the founder and co-founder and president of the Center for Medicine in the Public Interest. He's a former official at the FDA. He is someone who knows the business of healthcare well. And for many of you, you know him. It's Peter Pitts. Peter, welcome back to the Business of America.
My pleasure, Jerry. Thanks for having me back.
You bet. Now let's get right to it. So you and I co-authored a piece that CMPI, the Center for Medicine and Public Interest, published on hospitals and their crushing impact on patients and families, and specifically nonprofits. But give the audience a flair, a taste of what the paper is.
Oh, thanks. Well, the paper is called Unmasking the Real Cost Drivers of U.S. Healthcare. And the reason that I say unmasking is that when you ask most Americans, where does the American healthcare dollar go primarily? Everybody says, of course, pharmaceuticals, medicines. And that's not true. Drugs are about a dime on the dollar, 10% of the U.S. healthcare expense. Hospitals are between 30 and 35%, but nobody talks about that. And if you want to really fix the problem, you have to go to where the money is. Willie Sutton, the Depression era bank robber, they asked him, why do you rob banks? And he said, that's where the money is. So, our feeling is if you really want to fix the problem, you have to go where the money is, and that's hospitals. And then people say, well, why focus on not-for-profit hospitals? And that's because 60% of all the hospitals in this country are not-for-profit. So you need to go where the money is and then really focus in on the main buildings that are driving the problem. And in the case in the U.S., it's not-for-profits.
Yeah, and you'd think not for profit. This is a charity. This is an organization, a hospital system that does work for the poor first. Of course, everyone has to operate, so therefore resources and prices and cost are important. But when you think of nonprofit, you think, well, they're taking a break or a cut in terms of salary. I could earn that in the private sector, the private market, but the nonprofit market, I'll make a little bit less, and I do it on purpose. But as the paper shows, and some work that I've done, that's not the case. I mean, talk about the Cleveland Clinic.
Well, there's something called the fair share deficit. And the truth is that not-for-profit hospitals, about 80% of them, so eight out of 10, they spend less on community care for charity care than they do relative to the tax breaks they bring in. So they're saving a lot of money on tax breaks and tax incentives, but they're not turning that money around and putting it back where it belongs, which is in serving their community. And and it's a shocking number nationally. I mean, if you look at this fair share deficit, it's about $25.7 billion nationally. And that's more money than it would take to pay off the medical debt of every single person in California, New York, Texas, and Pennsylvania. So we're not talking about kind of marginal dollars here. This is serious money that's being misappropriated. And when you look at places like the Cleveland Clinic, one of our preeminent not-for-profit hospitals, over the last 3 or so years, they received about $1 billion in taxpayer funds and tax breaks. And you say, well, that's great. That gives them a lot of money to really serve the Cleveland, the greater Cleveland community. And that's not so. What they've done with that money is they pay about 22 of their executives over $1 million apiece. Now, I'm all for paying people fairly, but this is just not in keeping with a not-for-profit's community mission. And not only are they paying 22 executives over $1 million apiece, of the $1 billion that's left over, they're taking that money and they're putting it into their general coffers. So they're not even earmarking it for community care. So, examples like this abound, unfortunately, across the country. But the reality is that not-for-profit hospitals are behaving like for-profit hospitals. And that's because they are reimbursed by the insurance industry, both private and the government, based on the services they provide. It's called fee-for-service, rather than the outcomes they deliver to patients, value-based healthcare delivery. That's completely upside down. The pharmaceutical industry figured out a long time ago that they want to be reimbursed based on the value of their products versus the business of the operation. Hospitals like doing it the old-fashioned way because they get paid more and they're not held responsible for outcomes.
In the midst now of the big, beautiful bill, and there's lots of debate, discussion, a lot of scare tactics about Medicaid and Medicaid cuts, billions of dollars, millions of people being thrown off their health insurance. It's too bad we can't have a honest discussion on healthcare policy broadly, on Medicaid or on drug pricing or on hospitals. Part of the reason why is because the facts are obscured. There's lots of deflection. There's lots of like nonprofits pretending, or hospital systems acting as if they are engaged in massive charity care, helping the poor, helping rural patients. But in reality, they're getting billions, hundreds of millions of dollars in tax breaks and subsidies. And we're talking about how can we save billions in our healthcare systems. We have a $37 trillion debt. The CBO, the Congressional Budget Office, talks about how this big, beautiful bill could cost between $2 and $3 trillion deficits each year. So it's maddening. And this is why I wanted you on the program today. It is maddening to me that the hospitals aren't part of this conversation. Savings, more efficiency. What are some areas? Why aren't the hospitals a greater part of this discussion? And B, where can we go? What are the solutions? Where might there be some savings? And to your point, part of that is, how can we serve patients first?
Well, the reason that hospitals are not a bigger part of the conversation is they don't want to be. They're hiding, and they've been very successful. It's hard to attack a local not-for-profit hospital when their names are on the backs of little league uniforms. And I think it's really important to mention, Jerry, that this is not about the really fabulous service that doctors and nurses and pharmacists and aides and old people that keep the air conditioning running in hospitals provide. They're healthcare heroes. They are being disrespected and sold down the river by their management. Consider this. In New York, one of the largest hospitals here, NYC Langone, spent $34 million on promoting themselves to wealthy insured patients, rather than taking that money and plowing it into charity care. When you look at political contributions, in New York here and across the country, not-for-profit hospitals through their trade associations pour in hundreds of millions of dollars a year in political contributions. That's another way they keep their names out of the newspapers, so to speak, certainly out of the legislation, because it's a fat paycheck to our members of Congress and to state legislators. So what we really need is a lot more transparency relative to that. This information is in our report, and I tell you, Jerry, quite frankly, I was just shocked to see it. I was hoping it wasn't true. It is true, and unless and until we recognize that and start turning it around through more robust kind of naming and shaming, as well as greater oversight, the problem is not going to get solved. It's going to get worse. Relative to things like, the big, beautiful bill, hospitals are screaming that Medicaid is going to get cut, and that's not true. What is true is that the growth of Medicaid is going to be slowed, and that is a distinction with a difference.
It's very important too, because we have these arguments. Again, I'm the editor of Real Clear Health. You know that, our audience knows that, and I follow this. And unfortunately, I also have to follow the news. I have to watch CNN, MSNBC, Fox. I have to read the New York Times, Washington Post, and it's interesting. They're all singing from the same page. Massive cuts to Medicaid, throwing people off their insurance. Hakeem Jeffries, who's the leader of the Democrats in the House of Representatives, but also Chuck Schumer, who is the Senate leader for the Democrats, saying things like the GOP, Trump, will murder people. People will die. Tens of thousands of people will die. And again, if we could just have cooler heads prevail, I'm sure that there are true concerns about Medicaid and hospitals and all the rest, and we should have those discussions. But the rage rhetoric is something that is. I think it's something new. When I first came to Washington, D.C., there was a lot more, especially on healthcare policy and the business of healthcare. There was a lot more bipartisan conversations. We didn't always agree, but there was conversations. Now there's a lot of shouting. And again, I don't mean to be partisan here. Republicans should have taken some more intellectual buy-in here. Where are the GOP ideas? Where, if they don't want Medicaid for all, or they want to have a better hospital systems, well, where are the ideas? And I know some have them here and there, but my dad used to say, Peter, that the Democrats were the evil party and the Republicans were the stupid party. And I think this debate over the big beautiful bill is demonstrating that in real time. But specific to hospitals and the business of nonprofits, it's the 4th of July weekend coming up. I'm going to take my kids out to a ball game. We're going to go see a minor league game. I'm not going to buy them a hot dog or a soft drink if I don't know the prices. You look up and I know what everything costs. I go to a restaurant, I know what everything costs. I go to the grocery store, the prices are listed. But I go to a hospital, I don't know what anything costs. And to your point, fee for service, you're a patient, you're sick, you're dealing with all kinds of emotions and complications. And then you come in and there's all these tests and all these pills and interventions, and there's nothing priced. Is price transparency one of the problems with nonprofit hospitals and hospital systems broadly?
Well, the law says, the law that was passed actually during the first Trump administration, that hospitals have to be transparent about their pricing for their services. Hospitals don't like it, and they don't do it. But there's no oversight to really punish them. You mentioned Chuck Schumer. Chuck Schumer is my senator. Chuck Schumer is on the receiving end of millions of dollars from hospital associations here in New York. So it's not only dishonest, but it's disrespectful to the voters of New York to make us think that somehow Chuck Schumer is a disinterested party here, only interested in what he feels are the best policy solutions. But relative to this paper, Jerry, I think that our point is that the days of misdirection and distortion are over. Because when you leave these issues to the politicians, public trust and faith in not-for-profit hospitals erode. And when trust erodes, as it has with the FDA, for example, or the CDC, bad things happen. It also impacts access to care, because as I mentioned earlier, when not-for-profit hospitals, 60% of the hospitals in this country actively use their marketing dollars to recruit richer, more heavily insured patients, the result is they don't want to deal with Medicare patients. They don't want to deal with uninsured patients, which is exactly why they receive these billions of dollars worth of government funds and tax subsidies. So that's upside down. It is an absolute policy failure, and it's purposely being hidden away from the American public because hospitals don't like it. The people they give money to who are elected are doing their bidding. It sounds a lot like what people consistently charge the drug industry of doing. But for some reason with hospitals, again, the folks with the names on the back of Little League uniforms, it doesn't stick. So, I think this report, our effort in these types of interviews is really our best next step to really put this front and center and to name and shame who's really to blame here.
Again, the report that we did, again, published by the Center for Medicine and the Public Interest, needs to also be in front of every single healthcare journalist, a healthcare reporter, and also I think up to the Hill and in the administration, because I get in trouble sometimes, Peter, because I stick to a topic. I also do a radio program, and we'll start in hour one, and by hour three, I'm still talking about the same thing. And I get criticized sometimes. Why don't you move on? Why don't you go to the next thing? And my response to that is, well, that's the problem. The problem is we're always moving on. We're in the midst now of this big, beautiful bill debate. Health policy is part of this debate. The healthcare business, the nonprofit hospital business should be part of this debate. And I'm fearful because I agree with you. This needs to be part of the discussion, but I'm fearful that we'll just go on to the next thing. I mean, look, it wasn't too long ago that we bombed Iran, its nuclear facilities. But you go to the news today, there's nothing on Iran. It's all today. It's all about the Senate, the GOP, and the politics of Medicaid, and we're not talking about the things we need to talk about. What are some things that perhaps are there members of Congress who, I don't want to blame everyone for the problem that we have. Are there some looking at the business of nonprofit hospitals, the business of healthcare, hospital care, in a way that's constructive?
Well, the good news is it's the fog is clearing relative to where the reforms are needed. I heard that Dr. Oz yesterday was talking about the problem with executive paid not-for-profit hospitals, and he's a top gun in the administration relative to paying for healthcare. But there's a bill out there. It's called Holding Nonprofit Hospitals Accountable Act. It's by Victoria Sparks, who's a Republican out of Indiana, and again, it's holding their feet to the fire. I mean, rather than crabbing about the big beautiful bill that's reconciliation, it's almost yesterday's news. We have to move
Yes.
forward. We have to move forward, and we have to legislate transparency and accountability for not-for-profit hospitals. Step one. If people don't see it, they're not going to act on it. Secondly, we have to align incentives. You can't just pay fee for service anymore. You've got to pay for patient outcomes. This is common sense. This is the 21st century. Pharmaceuticals do it. Hospitals need to do it too. We have to redirect subsidies to those hospitals that meet their promised measurable community health standards. If they don't do it, they shouldn't get the tax breaks. And lastly, and again, this is coming from me, a former regulator, we need more robust oversight from the feds and from the states. And we have to kind of recognize that there's some shenanigans going on to campaign contributions, but the public has to insist that the federal and state governments do the right thing by them and rein in these not-for-profit, what's a polite way to put it? Poor action, poor player actions.
It's interesting. I'm listening to you, and you're reminding me of how, again, the healthcare discussion, the health policy discussion, the business of healthcare discussion used to be. What you just said, what you just laid out sounds to me like a bipartisan approach on how to make the business of nonprofit hospitals better, better for the communities they serve, better for patients, better for patient outcomes, but also for better business, right? We want these nonprofits to exist, but if they're behaving just like a private sector hospital or a for-profit hospital, better way of saying that, well, then what is the use? And again, we want a robust market. People make the mistake and think that America has a single healthcare system. We don't, right? We have Medicare, Medicaid, TRICARE, VA. We have the private market. We have the exchanges, and then of course every state has its different systems, and even down to the county. And one thing everyone agrees, everyone, left and right, agrees, is that we need to do a better job in the business of healthcare. And we talk about it, talk about it, talk about it. And I just, again, I'm a fatigued optimist or a despairing optimist. I think we can fix this. I'm just not sure when and how. And I don't want to have this conversation with you 10 years from now.
Well, I think that
What
I
do
think
you?
I think well, I think the key point here, Jerry, to that is we can't rely just on Washington to fix the problem. Under the best of circumstances, Washington can kind of incrementally move forward in the right direction, and that's being overly optimistic in many respects. I think that to really make dramatic change relatively soon is we've got to take this battle to the state level. And one of the things that I want to do now with CNPI is start doing state level reports on how individual not-for-profit hospitals in given states are not doing their jobs, because it's easier to name and shame and get actions from state houses who are closer to the people. They are the people, from governors who are closer to the electorate, rather than having Washington, look for universal solutions for everybody, because every state is different and every state has to do something its own way. But things that are not, I think, at all negotiable are transparency and accountability, realignment of incentives, making sure the tax subsidies go for what they were intended, and to keep an eye on these hospitals to ensure they do the right thing. And as appropriate when it comes to things like political contributions or executive pay, absolutely naming and shaming. That makes news.
You make a really good point. And one, I've talked about this hospital issue on my radio program and other venues. The state factor hasn't been discussed yet, and I think it's brilliant. I used to work for a member of the State Assembly in New Jersey. He was the chairman of the Health Committee. And we had visitors, not just emails or letters, men and women, families show up to our office. And we had office hours every day because state legislators are only in session part of the time. And so often the boss is there, and he would move legislation based upon the conversations he had with his constituents. So this is a brilliant point. But it's also so matter of fact and clear. I can see why folks would just skip over it. But reform at the state level, because you know what, rural care or poverty care in the Midwest will be different than in the Bronx, New York, or what's happening in Mississippi is different than what's happening in Michigan. And so you're right, we shouldn't be looking for a one size fits all from the feds, but looking at the states to do what the states do best, and these laboratories, so to speak, of federalism, of policy ideas. I mean, that's a great idea.
Yeah.
SPN. I'm trying to think.
Also, Jerry, when you are sitting in an emergency room and it's crowded and you're waiting for hours, you have to wonder, gee, why aren't there more nurses? Why aren't there more doctors? Why isn't this happening more quickly? Why isn't the technology better? We can't just make this a geeky, high-level policy conversation, although that's certainly fun, between us. You need to empower the doctors and the nurses who say, why can't we have better machinery? Why can't we have more assistance? You have to empower the communities by telling them the dollars that are earmarked for you, they're not being spent for you. Go look inside the parking lot and see what the hospital administrator is driving. Unless and until on the local level, professionals, healthcare professionals, people otherwise known as patients, get into the game, it's going to be very hard to change anything.
Again, I think that our paper, the work that you're doing, this conversation, I think is moving in the right direction. I am a fatigued optimist, but an optimist nonetheless. And I do think when you give people the facts, when you give them the information, very simple, make the complex conversational, bring it to the state level with reforms. I think there's a there's a way out here. And again, $37 trillion national debt, $2 to $3 trillion deficits year in, year out. No one's pleased with their health care. Even hospitals. I mean, people like the idea of the hospital in their neighborhood or in their district until they go to the hospital, and
That's right.
they and the check-in and the pencil pushers and the myriad tests without explanation. I was in the hospital, Peter. You know this. In the January of this year, I had a serious health scare. I was in the hospital for 6 days, and I felt at one point like I was in a prison. I had to get out. And again, the nurses were wonderful. The technicians were wonderful. But what I noticed was they were overworked. They were not always in the know in terms of what was happening. But it's to your point, resources and monies are going to administrators and executives and pencil pushers, and not going to technicians and nurses, nurse practitioners and doctors. And so when the conversation shifts there, right, the primacy of the primacy of personal, when you can articulate and make a narrative out of your personal patient experience, and then you multiply that, you can have an impact on the public debate. you're a busy man. Holiday weekend is upon us. Any last thoughts before I say goodbye for now?
Well, I would just say, when hospital administrators for not-for-profit institutions start mouthing talking points like the big beautiful bill is going to cut Medicare, when the truth is it's going to slow down the growth, and they know what's going on, and they're not telling the truth. They're specifically telling a mistruth to pad their own pockets. We're in serious trouble, and maybe things have gone far enough that it's time for everybody to get involved and really call it like we see it.
I agree. And again, the Business of America thanks you for joining us. This might be your third time. I'm losing track, Peter, but you are certainly the all-star guest for Business of America. And again, I think this conversation, to your point, this isn't sexy. Nonprofit hospitals, the business of nonprofit hospitals, but it's important and it's becoming urgent. And one thing I learned, the important things, once they become urgent, you don't have right fixes because you want to fix it in the short term. There's a lot of short-term thinking in Washington, D.C. And so my takeaway from our conversation today is one great way to fix the business of nonprofit hospitals is to get to the local and the state level, and we can see reforms happen. So Peter Pitts, CMPI, a good friend, a fellow, I'm a former New Yorker, you're a current New Yorker. Yankee fan?
Big Yankee fan.
Or yeah, well, they're not doing so well right now. Who knows? A lot of Yankee haters in the Business of America audience. But thank you so much for joining us. We're going to have you back because you're too smart and good looking not to have on the show. So anyway, Peter, thanks.
Back at you, Jerry. Thanks so much.
This has been the Federal Newswire's Business of America podcast, hosted by Jerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream.